Thinkers, thank you for joining us. There's some topics you have to know it. It's just the foundation of the NCLEX, so just make sure you understand them. But like I said, these are questions that are created based on content area. I want you to know. Okay, you have to know them before you go and take the NCLEX. Number one is pharmacology. Not every pharmacology, but cardiology pharmacology. They're very, very important. There's some medications. A lot of people are on it. Okay. There's a lot of people are on it. And so if you know about it, it's really, really, really very good. One of these questions, medication is Lansonipro. So I created this question. I expect you to know, but this is the way they will frame the question to try to deceive you. Which statement require immediate intervention? This is always screwed up people. They figure out what does that mean? Immediate intervention. It means they're saying something wrong. That's all. Rewrite it. Patient is saying something wrong. But what is the buzzword? You read a question from the back and then you say, oh, immediate intervention. That's what I'm focused on. What are they saying about what? What at all? And that is the buzzword. The client is taking what? Lensinipro for hypertension, comes to the clinic for a follow-up. So he's in a clinic as a follow-up and he's saying something that should concern you. So which statement below you think is a problem? If you know the answer, you can put it there. And then we talk about it. He said, I stopped eating bananas. So since he was prescribed Lensinipro, he said he stopped eating banana. Is it a problem? You have to be sharp, not an expected finding, right? I will inform my provider when I'm ready to become pregnant. Is this an expected finding or something you are not expecting in the patient taking Lensinipro? You have to be sharp. I tried a cough suppressant, but it didn't help me. What is wrong with it? Do you think it's an expected finding? When you take Lensinipro, you should be taking what cough suppressant to help you, right? I will make sure to get up slowly. What do you think? These are a collection of content related with Lensinipro. What do you think about it? And then you go back to your thing and say, oh, Lensinipro, the side effect is ACE, right? Angioedema. I don't see angioedema issues here. That is your airway. You are being sharp. I see cough. Why is he taking cough suppressant? Is he going to get better with what? Just taking cough suppressant? He's not supposed to. He's been coughing for a while. That's not a good thing. Electrolyte issue. He stopped taking banana because of the potassium. Right? You can say it's teratogenic. He said what? Before I get pregnant, I'll let you know so that you can stop my medication. Right? Orthostatic hypotension. He said I would get up slowly so that I don't fall down. So once again, be sharp. Which of this problem you don't think is what you should expect in Lensinipro? Any patient with Lensinipro telling you to stop eating banana, you say, oh, it's a good thing. If you get out of bed slowly, it's a good thing. If you let me know before you get pregnant, it's a good thing. But if you start taking cough suppressant, it means you have chronic cough. I said the question to get you the content. I have a chronic cough. Chronic cough, it's not true emergency. It means we got to do something about it. It's not going away. So we got to change it to ARV. Therefore, that need immediate intervention so that we can fix your problem. And that's how you answer the question. Okay? And that's the explanation right here. This is part of my crash course. If you get access to the Q Bank. I use some of my questions to make videos. Which findings should the nurse expect? Select or apply. Pick those you know you're confident. 101%, 120, 140. Don't pick anything you don't know. If it looks nice to you and you have no clue, leave it. Go away. Get your 1 point and go away. Don't pick because there are 5 answer choice there. There may be one answer choice. Stay away from it. They are traps. The select or apply are designed to make you pass. The new generation are designed to make you pass. Don't want you to over select. You pick those you know, and so pick it so that you don't lose the point. A client taking morphine for chronic back pain present to the emergency department with what? Suspected opiate withdrawal. When I read questions, I'm going for the buzzword. I don't look at every word. He said what? Expectation, select or apply. You see, I'm underlining them. I'm taking morphine and I have withdrawal. These are my buzzwords, and I connect the dot. What should I expect? I'm rewriting the question on my own. What should I expect when I'm taking morphine and I'm in the withdrawal? The question say withdrawal. So you circle it and your eyeball is on it. Withdrawal. That means I'm withdrawing. And then, okay, to answer this question, you said, okay, substance abuse is very confusing, but try to make it easy. First, identify the medication and ask yourself, what kind of medication is it? Morphine is an opiate. And opiate are what? Downers. That means when you take opiate, you go down. Your symptoms are going to go down. They are central nervous system depressant. That means they're going to put you down. Therefore, if I'm withdrawal, that means I don't have it. I'm going to go up. And that's all. You don't have to know specific symptoms. This is the way I attack substance abuse. It make it easy. You don't have to know specific symptoms. Ask yourself, I'm in withdrawal. That means central nervous system activation. I'm picking an answer choice that shows me there is central nervous system activation. Constipation does not tell me things are going up. When you're constipated, you're going down. Urinary retention, your urine is not coming out, it's not going up. Dilated pupils, your pupils are bigger than normal. Therefore, this sound like I'm going up. Bradycardia, it does not sound like I'm going up. Diaphoresis, it sounds like I'm going up. Therefore, what are your answer choice? It said withdraw. Pick an answer choice that tell me I'm going up. So which one are those? You can see dilated pupil and diaphoresis. Guys, that is the way I want you to tackle when you see substance abuse. Otherwise, you get them wrong. They're a little bit tricky. If you follow just the symptoms, they will trap you. Okay, so those are your answer choice. Next question. Which intervention should the nurse perform first? Look at it. Intervention first. Prioritization 101. The board is all prioritization, and prioritization is medicine. Every question they'll ask you, you have to think about prioritization. Ask yourself, I have to be sharp. I have to pick an answer choice that is going to kill the patient. If I don't do that, it's going to kill the patient. So I'm picking one that everything may be okay, but this one, it has to be the first thing. Don't overthink about it. That means you're being sharp. Is it a breathing, electrolyte shock, sepsis, airway issue? Then you ask yourself, which one is more? Even if it's a breathing issue, does shock overcome breathing in certain situations? Just because they need oxygen doesn't mean it's the number one. Always people pick respiratory problem. There is some situation oxygen is not never number one. I'm trying to use that as an example. Same thing as this question. A school age child with asthma, buzzword, present to the emergency department what? Wheezing, use of accessory muscles, and decreased breath sound. Those are your buzzwords. You got to bring your content. If you know anything about asthma, I have free videos on YouTube. You can watch them. Asthma, or you can join our membership. We have membership very cheap, the cheapest on YouTube. Now you get, I have almost like thousand videos, close to 900. that you can get all access to these videos. But look, wheezing, accessory muscles, and decreased breath sound. These tell you it's a pending respiratory issue, acute exacerbation. And if you bring your content regarding asthma, this is the airway, this is the lung, and this is the bronchial. You have muscle here. You get bronchospasm here. That is the problem. Air cannot go in. That is why it's using accessory muscle to bring air in, to open the bronchospasm. This is the kid problem. You go to the content and figure it out. If this is blocked, I cannot bring oxygen in. If this is blocked, I cannot bring steroid in. Think about it. Think about it. Therefore, what do you do first? I'll give you albuterol to open the airway. I give you a bunch of oxygen so that you can come in. I check ABG to see your respiratory status, or I give you steroid to take care of the inflammation. The basis of the kid's symptoms is because of bronchospasm. So A before S, that's they always say. But then what do you do with the oxygen? Open the airway first, and you can give him steroid or oxygen. Therefore, the patient get albuterol. You see how you attack these questions, so you get albuterol. So I say albuterol relieve obstruction, oxygen support the oxygenation, and steroid relieves the inflammation. Which intervention is a priority? Which one? A 6-year-old, you see, I don't give you a bunch of statements in the question. NCLEX questions are supposed to be non-ambiguous, one-liner, straight to the point, right? 6-year-old child with bacterial meningitis is receiving IV antibiotic, right? It's a 6-year-old. You get meningitis, you get the antibiotic. What intervention is a priority? Once again, whenever you hear the word priority, your antenna should go up. You said, okay, what is going to cure the patient? And then go back to the content. What is the buzzword? Bacterial meningitis. What would the meningitis do to the patient? What would he do? We follow meningitis. When you have meningitis, what one thing are you worried about? If you know it, put it in the answer choice. If you have bacterial meningitis, what one thing do you worry about most of the time? Why do we keep this patient in the hospital? Why? They have bacterial meningitis. Meningitis is inflammation around the meninges. That's the meninges surround the brain. It's not the same as encephalopathy. Encephalopathy is the brain itself infected. But this is what? The meninges around the brain get inflamed. What does it lead to? ICP. If I know ICP is going to go up in this patient, I know I'll keep you in the what? Well light environment, right? Is not good. Overstimulation, right? Quiet environment, right? Doing neurological exams to figure out if your ICP is going up. I know I'm going to maintain fluid restriction, right? In order not to increase your ICP. The kid is not going to eat right now. But the most important thing is I know I'm going to worry about the ICP because that is number one. And therefore, what do you think? You're going to check your neuro status. You know the answer choice, NCLEX will not put it there. You have to think second level, critical thinking. If you watch my videos, most of my questions, I want you to think critically. You feel like the questions are hard, but to think critically, say, oh, the answer is choice is there. I'm worried about ICP, but I did not put ICP. I put check neurological status, which is the same thing. What should the nurse do first? Same thing, prioritization. You see, I like prioritization because it's not only they give you a bunch of patients, but every question there is a priority. Even if it's safety question, there is a priority, right? This is also a safety question, a prioritization one. A child with tetralogy of Fallot became cyanotic and dyspneic while crying. That is text spell. Bring your content. I have a lot of congenital heart disease videos you can watch free. What should the nurse do first? Go back to your content and say, hey, what is wrong with the tetralogy of Foley? If he's doing this, he's having tit spill. There's too much chanting. Use your content to answer questions. Don't just look at the answer choice they've given you. I don't like that. I want you to bring your content. Don't read a question and you have no idea. Like, I'm not even look at a question. I said, first, I see tetralogy of Foley, cyanotic, dyspnea. In my brain, I tell myself, this is O, tit spill. How do you treat it? I need to prevent shunt. How do I prevent shunt? It depends on the kid. Is he a small kid or somebody who can squat? If he can squat, I'll help him. Therefore, which answer choice? I know they need oxygen. I know they need morphine. I know I need to check ABG. I may not need to intubate the patient, but which one is the easiest thing you can do to prevent shunt? Oxygen is not going to prevent the shunting. Knee to chest will prevent the shunting. Immediate intubation is not needed. It's not because he's having airway issue. You see how they will trap you with this? If you know the content, you know it's not because the kid is having airway issue. The reason why he's having cyanotic and dyspneic is because he's shunting. Therefore, prevent the shunting. Checking ABG is not going to help you. They already told you. Your question already told you cyanotic and dyspnea. ABG is not going to help you. Don't pick it. Don't pick it. Just pick the things that will help this patient. And this is assessing a newborn immediately after birth. So we're back to newborn. Newborn, you have to know it. We just did safety prioritization. Now we are newborn, right? You have to know these are topics, newborn. Which findings should be reported to the provider? You see the way they ask you the question, which one should be reported to the provider means that one you don't expect, right? Watch for newborn way they frame the question. Reporting to the provider means I don't expect this. It's not an expected finding. That means it's a priority. It's something out of the range of what you should expect. And therefore you have to be sharp. Acral cyanosis of the hands and feet. When the kid is born, do you think the hand, fingers and the toe is supposed to be blue? And when you see it, should you be worried? Respiratory rate of 65. A kid that is born, should the respiratory rate be 65? Caput secundinum on the scalp. Do you know about it? If you don't know, it's fine. You just have to read about it. I will show you. Positive Monroe reflex. Then you go back. You said, should a kid that is born have the Monroe reflex? Of course, yes. It can stay there up to like 3 months, right? Minimum 3 months. So this is good, right? Caput secundinum, yeah, is I use the C and the S, crosses the suture line. If you look at the kid, sutures the head during birth, there's trauma, and we have sutures in our skull. Sometimes we get, these are the lines on your skull. You can have hematoma. So you can have hematoma here, and you can have hematoma that crosses this suture line. The one that CS crosses suture line is called capital secundinum, right? And that one, both of them goes away. It's a trauma during birth. It's not bleeding. This will go away a week or two. Don't worry about it. You have to know this. Their respiratory rate is 30 to 60. Anything over 60 is bad. I expect the hands and feet to be blue. All you need to do is give the baby to the mommy. That is the intervention. If I say central cyanosis, yeah, this is a priority. It may mean congenital heart problem, tetralogy of Foley. So central cyanosis in a kid, newborn, is worrisome, but acral cyanosis is an expected finding. So we pick 65. What is the preferred injection site? This one, management of care, in addition to pediatric, you have to know it, right? A nurse is preparing to administer IM medication to a 6-month-old. This one, you have to basically, you know the answer. You don't even have to look for the answer. A 6 months old is not well developed, does not have a lot of muscle. That is the content you use. You see, I don't memorize it, I just give you the content. 6 months old does not have muscles, so you don't put it in the muscle. There's no muscle, good muscle there to put it. Therefore, it has to be huge, right? And dorsal gluteal, your gluteal muscle has to be big. Kid doesn't have it, and the ventral gluteal too, they don't. So you left with this vastus lateralis. So these are like way to answer question. I know 6 months old does not have big muscle, even though he's getting iron medication. I have no choice but to put it here, right? I know you guys know, but I'm trying to demonstrate content areas and the key way to answer questions. Same thing. This is a bunch of statements, but the answer choice is straightforward, right? Which statement by the parent indicate the need for further teaching? They saying something wrong. A nurse is providing district teaching to a parent of infant diagnosed with what? Reflux. You know, reflux is the same as adult, right? We have reflux. You're supposed to eat small, frequent meal. I'm giving you the content at the same time, right? For small frequent meal at a time, right? You got to remain upright, right? All those things. If it's an adult, you got to raise your head up, right? We will hold our baby upright 30 minutes after feeding. The same thing as an adult. We will take in formula with rice cereal as recommended so that they is too much liquid will let them reflux. I'll place the baby on their stomach after feeding. You know, there's no prone position. Baby has to be on their back. It's a newborn, right? Infant. Otherwise, we have sudden infant syndrome. You have to bring that content here, even though it's related to reflux. You know that placing the baby in the no matter what it says, baby face down is always sudden infant syndrome. You should not do that. We offer small frequent meal. It's acceptable. Therefore, this one is not good. Okay, this one is for you. Try it. Let me see. A nurse is caring for a client 2 hours postpartum with heavy vaginal bleeding and a firm midline fundus at the umbilicus. What is the most likely cause? I will lead you. Is there most? That means all of this can cause the problem. The nurse is caring for is a 2 hour or 2 hours postpartum, right? Mommy is bleeding, heavy vaginal bleeding. But what is the problem? We have a firm midline fundus and the umbilicus. Now we're on maternity. You have to master your maternity. If you need more, I have a bunch of playlists. You can watch it free on Adapting Class. But look, what is causing the bleeding? I've underlined the content and I want you to use to answer the question. They say, which one is the most likely cause of this bleeding? Think about it carefully before you select your answer choice. Think about it. Firm midline uterus, 2 hours, and I'm bleeding. Is it retained placental fragments? Is it urine atony? Is it vaginal laceration? Is it disseminated intravascular coagulation? What do you think? Think about it. Use the buzzwords most and then firm midline uterus and 2 hour postpartum. The key is this 2 hour postpartum. Define this. What is urine atony? It's boggy, big, and soft. If this is atony means big and soft, the question says, I have a firm midline fundus at the umbilicus. That means it can be urine atony. You see, therefore, that is gone. What would retain placenta fragment do to you? It give you a boggy uterus. Therefore, it cannot be this. This is also gone. What will DIC do? I'll be bleeding from every place. Disseminated intravascular coagulation. You're going to bleed from your nose everywhere, IV line. You don't just bleed from the vagina. Therefore, it cannot be DIC. Just by elimination and content strategy, you can see it has to be vaginal laceration because this is it doesn't indicate anthony and it doesn't indicate DIC. So this is a vaginal laceration. Not every postpartum will be related to vaginal urine anthony. Watch for that. So just look at the questions they've given you. You can memorize the questions. Don't memorize them. Look at the whatever they've given you and use the strategy to tackle it. Just step back, fight it. Say I know this. Firm midline uterus does not means the uterus cannot be soft. And urine ethony is a soft uterus. Retained placenta is a soft uterus. DIC, I'm bleeding from everywhere. Therefore, by just even if I don't know what vaginal laceration, you got to pick it. Don't be nice. Don't say I don't know them, so I'm going to. I don't know the right answer, so I'm going to pick the one I'm confident. I feel familiar with. Ethony does not mean the uterus is firm. Retained placenta does not mean the uterus is firm. So just just approach questions like that. And that's the explanation I gave you. Firm uterus with the heavy bleeding suggests trauma, not urine ethony. Retained fragment causes buggy uterus, right? Uterine ethony causes soft uterus. DIC present with a widespread. So this is not DIC either. Which finding requiring the nurse to immediately discontinue the infusion. A nurse is caring for a laboring client receiving oxytocin, pitocin. This is also maternity. I'll see if you master your maternity, right? That means patient is in labor, receiving pitocin. What will cause us to stop the pitocin? Contraction is occurring every 3 minutes and lasting 60 seconds. You have to know your contraction timing. Gradual fetal heart rate decreases that starts after contraction onset. You have to know your stuff here. Moderate variability in fetal heart rate. You have to know non-reassuring fetal heart rate. Gradual fetal heart rate decrease at the start of, this should say at the start of each contraction. So what do you think? What do you think? This is for you. Try and see let me see what you think. If you know the answer, you can put it there. So which finding the nurse required the nurse to immediately discontinue the infusion? The nurse is caring for a laboring client getting Pitocin. Contraction occurring every 3 minutes and lasting 60 seconds, right? Gradual fetal heart rate decrease that starts after contraction onset. Moderate variability in fetal heart rate. Gradual fetal heart rate decrease at the start of each contraction. What do you think? This is a hard one, but it's not. If you look at the answer choice carefully, you can figure it out. Pitocin, and I need to stop it. Go to your content. What was, let me stop Pitocin? That means something is not right, right? Baby is not doing well. Contraction every 3 minutes and lasting 60 seconds. Bring your content. If the contraction is greater than 90 seconds and at least 2 minutes, they're good. This is 3 minutes. It's greater than 2 minutes. This is less than 90. So if you're greater than 90, you have problem. And if you're less than 2 minutes, you have issue. So less than 2 minutes and greater than 90 is a problem. So at least 2 minutes and less than 90 is good, right? So he has 3 minutes and 60 seconds. This is good. If the fetal heart rate decreases, that start after contraction. That means baby heart rate drop after mommy contract. That means this is what? Late deceleration. Compared to this, fetal heart rate decreases at the at the start of each contraction. This is acceleration. And moderate variability. It's a good thing to have moderate variability. That means you go up and down, up and down. That's good. That means your heart rate go up and down. And so you can see that we have acceleration for D. That's a wrong answer. Moderate variability is a good thing. Contraction, timing, and duration is good. This is late D cell. Instead of me telling you late D cell, I know you will pick it. I did not. I describe it. Gradual fetal heart rate decrease that start after contraction onset. That's late deceleration. And so B is the right answer. And it's a trap, right? Okay. This is infectious control. And next is evaluating infectious control practice of assisted personnel. So UAP, we're looking at them and they're doing something. Which of these should worry us? Which action should require immediate intervention? Using alcohol-based sanitizer after removing gloves from a patient with MRSA. Think about it. Is it acceptable when you remove your gloves from MRSA patient? Should you use alcohol? That's all. Infectious control is something you have to master. I'll make it easy if you join our crash course. It's just like something you have to get up and wake up and say, I know this. You can't memorize it, but you got to have the basis. Tuberculosis in airborne isolation, you know what it means. You wear surgical mask for a patient with influenza. Is it acceptable? Do you wear gown and gloves when you're changing dressing for patient with a VRE? Go back. VRA is contact. Contact, gown, and gloves. If there's a splash, you wear face masks, right? This is good. Surgical mask, influenza, droplet, surgical mask, good. TB, airborne, isolation, good. MRSA, you can use alcohol. The only thing you need to do is wash your hand, soap and water. This one is not acceptable. Same thing, infectious control. Which of the following interventions should a nurse implement? A nurse is caring for a client with C. diff. The best way to master infectious control, every time look at the organism and ask yourself, what precaution do I need? The precaution is to prevent the transmission of the disease. If it's contact, make every effort to avoid contact with the organism. So everything you're going to do is about contact. Wearing a mask is not a contact precaution because you're not touching the patient. Contact means I have to touch the patient. If you put a mask in your face, you are not helping. You're not kissing the patient. So there's no way you got to put something in your mouth or in your face. So N95, of course, is not a contact precaution. Client in the private room is a good thing. It's in the contact precaution so that we can stay away from it. Perform an hygiene with soap and water. I told you the sport Clostridium, we need to wash our hands. Clean equipment with what? Alcohol base. Alcohol base is not going to help you. You need to wash your hands. Dedicated equipment means you alone going to use it because you have contact precaution. This is good. And that's how you approach it. Okay. What is the priority nurse intervention? A client with Alzheimer's disease is found wandering in a hospital all way to leave the building. What do you think? You want to wander and leave the building. Just redirect this patient. Alzheimer's, you can restrain them. You cannot give them medication. You got to find somebody to help you, but redirect and then reinforce your teaching every time with them. Bed alarm is fine, but the patient is already wandering. Bring them back in. Lorazepam is not acceptable. These are what we call best criteria. They should not get benzos. You're going to get confused and go crazy. Redirect the patient, provide their name, take them to their room and take care of them. Restrain is bad. So this is what we do. Which client is the most appropriate to assign to a float nurse? Management of care. Floating nurse, key concept, don't give them specialized care. Once again, Don't give them specialized care. We know they are nurses, but don't ever give them a specialized care. The charge nurse is making a client assignment for a float nurse from the orthopedic unit, right? She came from orthopedic unit. She's a nurse and making an assignment. Who would you give it to? A client with chest pain getting nitro. You think it's okay? It's a floater. A client with chest tube with pneumothorax. It's okay for a floater? Client with new onset AFib receiving amiodarone. Client with DVT receiving enoxaparin. Don't give them a specialized patient. Don't give them specialized patient. Therefore, what will you give this patient? What do you think? Which patient do you think they should see? Which patient do you think is appropriate? Chest pain and nitro is a specialized patient. She doesn't know anything about it. Pneumothorax and a chest tube is a specialized patient. She doesn't want it. AFib with amiodarone is a specialized patient. DVT, all she needs to do is just give them medication. So this is what you can give it to them. Any last question? A nurse is caring for a 2-year-old who ingested a large amount of acetaminophen 6 hours ago. Which intervention is the most appropriate? Look at it. There's a bunch of keywords. 2-year-old ingested what? Acetaminophen. I give you time. That means long time ago. Now, 6 hours after you injected, there's nothing you can do. You don't want to vomit induce vomiting. You don't want to do anything. It's too late. Now you got to deal with the consequences. Always think about it. When they give you these times in the question, they are there for a reason. Don't pick, you've seen these similar questions somewhere. The English questions are the same. No, they can take the same thing and flip it. You've seen this question in the video before, and somebody said this. But there's a change. It's a 2-year-old. At the same time, this happened 6 hours ago. The damage already done. Go fix the damage. What would you give to this patient? Activated charcoal, it should be given in an hour. We're going to monitor your liver function. Yeah, it's going to affect your liver. But is that the most important thing right now? No. I want to prevent the damage. Monitoring the liver, you don't do anything. You're just checking to figure out if there's the damage. Giving them antidote is a good thing. It will take care of the disease process before it becomes a problem. Encouraging fluid, you are not doing anything about the problem. Acetaminophen, 6 hours ago, give them an antidote. If it's within 1 hour, you cannot do activated charcoal. But this kid needs that. This is our Dr. Class. Thank you for joining us. Like I said, we have a membership if you want to join us. Like I say, it's not that too expensive. And then if you want to join our crash course, this is the way to register here. But thank you for watching. I hope you learned anything. These questions are just designed to content area. We did newborn, peds, maternity, management of care, and prioritization. Those are 5 areas you have to know, topics to know for your NCLEX. And good luck. Best of luck. Bye bye. Adapting class out.